If your skin gets easily irritated, red, or reactive to various skincare products, you may have sensitive or even rosacea-prone skin. As a board-certified dermatologist, I see many patients who struggle with skin sensitivity, whether it's due to weakened or damaged skin barrier or due to underlying condition like rosacea. And finding products that work as well as developing a routine can be so challenging, but I want to help you. So in today's video, I'm going to offer some tips as well as recommended products and come up with a routine that will work well for your sensitive skin. So if that sounds good to you, I would love it if you can give this video a thumbs up. Don't forget to hit that notification button and subscribe to my channel. So briefly, I want to review sensitive skin and rosacea. For me, it's a continuum, almost like a spectrum. Rosacea is a chronic and progressive condition that really has no cure. So you kind of deal with it, manage it lifelong. Sensitive skin is similar, and sensitive skin can be a mild form of rosacea, but there can also be people that just experience temporary sensitivity because they might not have sensitive skin at all, but they just used wrong skincare products or use too much of it, and they are temporarily have that sensitive skin. And for the most part, people will know like whether they have sensitive skin because they struggle with it pretty much lifelong. They have a hard time finding products that work. And rosacea, there are definitely clinical signs and symptoms. And then usually people that have temporary sensitivity, they probably also know that they may have overdone it with skincare products. And the thing with rosacea is that there are various different subtypes and kind of a combination of different findings. Having sensitive skin is very common, along with usually kind of this redness, broken blood vessels, and flushing that may be exacerbated by certain triggers like spicy food, caffeine, sun, heat. There may also be inflammatory papules that would kind of break out mid-face, nose, chin, and cheeks, along with maybe even ocular findings. It can be affected your eyes. Your eyes can be affected by rosacea. It's called ocular rosacea, and also even like sebaceous enlargements over time that can progress as well. Most people usually have that sensitivity, redness, flushing, and then maybe acne-like bumps. And then some people can just have, like I said, baseline, very mild skin sensitivity that can be defined by burning, redness, itching, flaking of the skin. At the end of the day, rosacea is very complex. We know that there's a lot of components that drive rosacea, but what really holds all of these things together, whether it's sensitive skin, rosacea, or temporary sensitivity, is that there is a damaged skin barrier. And then obviously there's more inflammatory and nerve response involved with rosacea, but we do know that damaged skin barrier is one of the major components that really drives sensitive skin, whether the cause, and that there is increase in water loss. And so repairing and protecting and supporting your skin barrier is really the fundamental aspect of sensitive skin, whether you have temporary sensitivity, just sensitive skin type, or rosacea-prone skin. And certainly, I actually have a dedicated video to rosacea. It's an older one, but happy to make an updated one if you guys would like to see more updated version with product recommendations, but I'll make sure to link that one below. Okay, now let's get into an AM and PM routine. But before we talk about that, I just want to mention two things. Number one, less is always more when you have rosacea, sensitive skin, or temporarily sensitized skin. Two, remember that rosacea is a medical condition. Certainly, the skincare routine is really important and is really the backbone in keeping your skin healthy, as with anti-aging or acne. But at the end of the day, rosacea is a medical condition that is going to be best addressed with proper prescription treatments, topical creams, or even in-office procedures. So, you know, the routine that you can get over the counter, drugstores, that is really going to be key in supporting your skin day to day, but they're not going to be effective in addressing your true medical concerns. So that is where you want to see a dermatologist, and really the two will complement each other. So if you're not getting the results that you are seeking with this routine, then this is where, if you have rosacea, please follow up with a dermatologist. Okay, now starting off with morning routine. Number one is gentle cleanser. This is where an area where if you have super dry and sensitive skin, you can even skip using a cleanser in the morning and simply splash your face with a little bit of water to dampen the skin, or even like little spritz with like one of the thermal spring waters from like Aven or La Roche-Posay. The reason is that damp skin really sets your skin up for better absorption of water and moisturizer and all the other products that you put on next. It's going to be better than putting on dry skin. But if you do wear a lot of thick stuff the night before, or say like you slugged the night before, then using a gentle cleanser can help to just clean your skin off, so that way whatever you put on next is better absorbed. So here I'm going to go with one of my all-time favorites I recommend to patients, which is the Vanicream Gentle Facial Cleanser. This is a soap-free, oil-free, fragrance-free formula. Vanicream itself, that whole line is just great for dry, eczema-prone, sensitive skin. This is really great for, if you even want to remove some of the basic makeup. I think it lathers really nicely, comes off fairly easily unless it's waterproof. I even use this cleanser in the winter time for my hand, as to wash my hand, because it lathers nicely, but it does not strip your skin. It's not over drying. So this is a great one. It's also approved by the National Eczema Association. It doesn't clog pores, so just suitable for like dry, eczema prone skin, sensitive skin to use once a day or twice a day. Another cleanser I really like, if you're looking for something that's still affordable, drugstore, but with a little more active ingredients that maybe offer some calming, soothing benefits, is Cetaphil, the redness relieving line. I love that line. I love that moisturizer. They also have a foaming face wash that's also gentle, not irritating, suds nicely, but not stripping of your skin. It's gentle to remove sebum, buildup, and makeup without causing irritation. Plus, it also hydrates with glycerin and also has allantoin, licorice extract, and caffeine. In a cleanser, I think in the moisturizer, it really has long-term benefits, but this one here maybe can temporarily help to reduce some of that irritation and calm your skin as you're cleansing. So just another option for you if you want one more for like sensitive skin that does the job of cleansing without stripping your skin barrier. Next, we're gonna put on a serum. Yes, you heard me. Serums are okay when you have sensitive skin. It just depends on the situation. Now, if you have super red, angry skin because you just exfoliated the crap out of your face and your skin barrier is super damaged, I don't recommend anything except for like petrolatum or barrier cream. But this routine is more for like day-to-day. If you want something that's calming and soothing in a serum that is a little bit more than a moisturizer, this is where to use it. And there are a few that I recommend that can offer those benefits. But if you find them too irritating or burning, you may have to try a few before you find the right one, or you can totally skip this step and just go straight to moisturizer. So the first serum is the ordinary azelaic acid 10%. So azelaic acid 10% really offers more calming and soothing benefits. If you're looking for the anti-pigmentation, helping with hyperpigmentation, it's really prescription strength of 15 to 20% that's shown to have the best evidence. But 10%, it offers probably more calming and soothing benefits. This one is affordable, helps to target, maybe helping with some uneven skin tone, dullness, but really has antioxidant benefits as well, and also has squalene in the 10% azelaic acid that may offer some barrier support along with glycerin. Another choice of mine I really love that I sometimes use myself is from Paula's Choice, their Calm Repair Serum. I really love this one. It's for me when my skin just gets a little irritated, especially during the winter time. This is a great calming and hydrating serum that provides kind of that nourishment that is not super heavy that I can layer on before my moisturizer. So this is an antioxidant rich serum that helps to soothe and hydrate sensitive skin, reduce redness at the same time, and strengthen your skin barrier. Contains hyaluronic acid, ceramides, feverfew extract that calms and soothes, along with licorice root and beta glucan. That is another great humectant that offers soothing, calming, and hydrating benefits. Step 3 is moisturizer. This is non-negotiable, especially if you have rosacea and sensitive skin. The serum is optional, but this one you should not be missing. You need to put on your skin every single day, twice a day, especially after cleansing. The first one is from Aven, the Redness Expert Soothing Moisturizing Concentrated Cream for Redness Prone Skin. I love this line. This is a relatively new line from Aven. I actually am obsessed with their serum, which I should have mentioned for last category, but I just wanted to mix it up and not mention products from the same brand. But their redness prone, that serum in this line, the Redness Expert Soothing line, is amazing. I love it when I want an instant soothing, calming, hydrating effect. That one is also worth checking out. But this moisturizer is equally nice. What it does, it helps to visibly reduce redness and soothe irritation, strengthens your skin barrier, at the same time provides hydration, nourishment, but it's not heavy and it's lightweight and fast absorbing. Great to use in the morning, especially I personally love it under sunscreen because it layers nicely under sunscreen. Ingredient wise, it contains this active, I'm not even going to pronounce it, I know I'm going to say it wrong, but essentially it's derived from milk thistle. That high concentrations of it helps to really reduce redness and calm inflammation, induce kind of that sensitivity, if you will. So this is a great one, along with thermal spring water that is rich in the postbiotics that helps to calm and soothe the skin. So this is a lovely one to use, especially if you're more prone to redness and want kind of some of that temporarily redness relief aspect. One worth looking into. Another one is a Korean brand. It's called Althea 146 Barrier Cream. This is a really nice one that helps to strengthen your skin barrier, at the same time provides deep hydration, and it's lightweight and non-greasy. It contains plant-derived extracts along with various different blends of ceramides and hyaluronic acid, as well as avocado fruit complex and other ingredients derived from chamomile that we know calms and soothes the skin. So just a wonderful blend of ingredients, but really a even more lightweight texture that is great to use if you have sensitive skin, or even like oily sensitive skin, to use in the morning, layers nicely under sunscreen, or as we head into warmer months, if you want something that is going to support your sensitive skin, this would be a great option. Number 4 is SPF. This is the other non-negotiable part when you have sensitive skin and rosacea. In fact, we know UV light is actually one of the pathogenesis, like one of the triggers for rosacea, and will worsen your redness and dilated blood vessels. So every single day, sunscreen is non-negotiable. And here I actually recommend mineral sunscreens because they're less irritating, and green tinted ones that can offset some of that redness. So one that is a new launch from Ulta MD that is amazing. Love it for just everyday redness, but also post-procedure redness as well. The Skin UV Recovery Red color correcting green tinted broad spectrum SPF 50. This is a lovely one that, like I said, has that green tint to offset redness. It's 100% pure mineral, great SPF coverage 50. That is broad spectrum, protects against UVA and UVB. It's soothing, it's hydrating, and it helps to offset that redness. It's lightweight, doesn't leave any white cast, and it's a lovely one to try if you haven't. Ingredient-wise, contains zinc oxide along with centella, ceramides, and amino acids, all to support your skin barrier. And that green tint, once it blends in, is really lovely. It does not make your skin, at least when I use it post-procedure, has not made my skin look ashy and hasn't pilled, does not leave like a white cast. So definitely worth looking into. And the other one is from Color Science, the All-Come Clinical Redness Correcting SPF 50. This is like a 3-in-1 mineral sunscreen that also color corrects and also offers skin barrier support. This is also 100% pure mineral, offers broad spectrum UVA and UVB coverage that contains zinc oxide and titanium dioxide, and has neutralizing green tint that helps to instantly offset some of that redness, along with niacinamide and antioxidants to support your skin barrier. And so just another option for you if you're looking for more sunscreen recommendations. And the last one that kind of comes off the top of my head is Dr. Jart, their Targar Grass line, that green one, that also is 100% mineral and contains green tint that can offset some of the redness, and at the same time is calming and soothing and hydrating. Okay, now moving on to evening routine. Here, I recommend using the same Van & Cream cleanser because that one works really well, or the Cetaphil one if you prefer that one, but you don't have to switch up too many cleansers. You can certainly double cleanse if you wear a lot of water-resistant makeup or sunscreen. Double cleanse is needed. Using micellar water can be another great option, and I have quite a few videos on those options too if you want to watch my older videos. But if you don't wear a lot, and really, like I said, less is more for sensitive skin, then just using any of those cleansers I mentioned earlier for the AM routine will get the job done. Step 2, serum. Again, you can use the same one, or say if you want to use one the morning and the other one the PM, this is where you can certainly try out products and how you can minimize using various different types of serums without irritation. Is when you have sensitive skin, I recommend instead of layering serums, you split them up by AM in the morning and PM routine. And so this is where I mentioned a couple of them. If you want to try one in the morning and one in the evening, depending on the texture and how well it works with your other moisturizers or sunscreen, that is one way to do it. Or here, you can certainly put in some actives, but you have to just be very careful. Always start off slow and low, and then kind of gradually increase the frequency as tolerated. And this is where maybe like retinols could be an option, and that's not the kind of purpose of this video, but you can certainly consider retinols, or even use like a peptide, or say if you are wanting to add in like a gentle exfoliant, ingredients with like polyhydroxy acid would be a good place to put it in this routine before your moisturizer. And again, always start off low and go slow. Then going into the important non-negotiable aspects of the nighttime routine, moisturizer. So this one, as I mentioned, I prefer more rich, creamy moisturizers that I love for my skin that better support our skin barrier. And I think this is very important when you have sensitive skin. Most people with sensitive skin tend to have dry skin. Our skin barrier does most of the repair at night as we sleep, and studies have shown that we are more prone to transepidermal water loss overnight. So this is kind of the reason why I personally prefer a creamier moisturizer at night, and why the idea of slugging works really well overnight. Also because most people don't like walking around with a greasy face, right? But this is where I think going with a creamier moisturizer, more nourishing moisturizer, is going to be to your benefit. So the first one is the Cetaphil Redness Relieving Night Moisturizer. This is, again, formulated especially for redness reactive skin that helps to reduce the appearance of redness, calm and soothe your skin, but also help to support your skin barrier. And this one I do love because it is a little bit more creamy and nourishing, but again, not greasy or heavy like your skin is suffocating. I love the wonderful ingredients in here that is, and I feel like this is one of the very few moisturizers when my skin was really sensitive that did not burn on my skin, and that is why I'm recommending it and why I've always recommended it to my patients and the viewers here. It's just a wonderful product that you can easily find at drugstores. Ingredient wise, it contains allantoin, licorice root that's calming and soothing, along with caffeine that can help to temporarily vasoconstrict and reduce the appearance of redness. Niacinamide that also supports your skin barrier but offers some hydration component helping to rebuild that skin barrier lipid, along with panthenol, ceramides, and glycerin. So just a whole list of wonderful ingredients that really help to work on repairing your skin barrier at night as you're sleeping. And then another option is from Eucerin, the Redness Relief Night Cream. A little creamy as well, but not greasy, not heavy, not suffocating. It again helps to provide that extended overnight hydration as you're sleeping, as your skin is repairing itself, with additional benefits. Really ideal for sensitive skin and rosacea-prone skin. It's not comedogenic, fragrance-free, and by the way, all the products I'm recommending today are fragrance-free. So really ideal for those that have sensitive skin and rosacea-prone skin. Ingredient-wise, it contains a licorice root derivative that is calming and soothing, along with glycerin and evening primrose oil that helps restore and support your skin barrier function. So just another option if you want another moisturizer to use, but really find the one that works the best for you, that you like, that doesn't irritate your skin. I think is really the most important piece here. Despite all the products I've recommend, if you've been doing what you've been doing and you have sensitive skin, it's working well for you, continue. But if you're looking for options, these are great ones to try. And at the end of the day, even though I recommend, if it doesn't work well for you, stick to what works best for your skin. All right, guys, so that is pretty simple. I think this is a doable and also one that kind of helps address concerns, laid out in a way that is still simple yet effective. And like I said, when it comes to sensitive skin, less is more, but I still made room for serum if you choose to have that in your routine. And again, this is where look for products that is going to be more soothing, calming, fragrance-free, geared towards sensitive skin. And if you do want to use actives, less is more. Stick to ones that are more gentle, like peptides for anti-aging, polyhydroxy acids for exfoliation, and then maybe more sensitive skin type retinols. And a lot of times, like I said, it is going to be a trial and error. And at the end of the day, there's so many products out there that are great for sensitive skin. Just find one that is going to be best for you. And sometimes it could be a little bit of trial and error. Let me know if you have any questions, and let me know if you want to see more of this routine style video where I design a routine for a certain skin concern or skin type. If so, leave a comment if so, drop a comment below and I will work on that next time. Thank you so much for watching, and I'll see you soon.